First day back to work at my clinic, and it's hectic because everyone has to redo all of their forms for the year, like privacy policy, social media, all of that. And then since I don't do like routine primary care mostly, like we get vitals once a year, so I have to do that for all the appointments starting today. So it will be a very busy day, and my son will be with me. So let's get to work. Okay, I'm in the dark because my son is asleep. So I have a pretty full day. I have to take my daughter to get a filling later, so I'm leaving a little bit early, but I have 6 appointments for me, and my nurse has 5 appointments. So I think they're all follow-ups, and one of them is for hormones. She's thinking about getting started. The other ones are all weight loss follow-ups, and they've all been here for a significant amount of time. And then we have a few injections. We have 2 vitamin Ds, a Mega Burn, one of the weight loss injections, and an AminoBlend injection. So pretty busy day to get us started. All right, my first patient, I see them every 3 months, and their last appointment, they were down like 13 pounds, almost 14 pounds, and then they've gained that all back since October. So I always tell people the holidays are not the time to try to lose weight. We're trying to maintain. Obviously, over this time, they have not maintained either. They also have been on the medicine for like a year and a half, so we're going to lower the dose and then reintroduce higher doses and play around with it. But it's just important that you don't be hard on yourself, because this is the roller coaster that is weight. They were down altogether 70 pounds, so they kind of gained like 20 pounds. But yeah, we're still working on it. It's still good. All right, it got a little crazy for a minute, but I am done now, and I can recap the rest of the day. Okay, so all of my injections have come in except for one. Everyone got their injections. I had another weight loss follow-up. She was down 5 pounds, but she's already a lower weight, and so she just couldn't lose like her final 15 pounds. So she was down some more. She has 5 more pounds to go. I had someone restart. They stopped in July, and they've been maintaining, but then they were put on like an anti-anxiety medicine, which a lot of times make you eat. So she is restarting, and she also enrolled in our like total program, and her vitamin D was low. And then I had another new patient. I did a follow-up call, and they decided to enroll in our hormone replacement and tackling that. So that is a new patient. And then I had one of my maintenance follow-ups. She's been here for maybe like 2 years or so. It's a new day. I never finished yesterday, so let's talk about it. I have a patient who's been with me for a few years who decided is continuing maintenance, but now I only need to see them yearly. They're on maintenance. And then I had another patient who's been with me for like a year and a half. She was down 15 pounds from her last 3-month visit, and yeah, she is continuing her treatment. So yesterday went pretty well. I'm just gonna run this into the next day because I have another full day today and tomorrow, so I'll just do all 3 days. Today, we just have 4 patients today. I have a women's follow-up. So like I have a hormone follow-up, which those look pretty good. I have a weight follow-up, and from the weight follow-up, I can tell that they're not doing what they're supposed to on their end because they had lab work done. I have a new patient, and then I have another weight follow-up. So yeah, that is today. And then we have a couple injections. So that will be what we're doing today. I saw my first 2 patients today, and okay, so first one is hormone follow-up. She feels amazing, not making any changes. Do not have to see her again for 6 months. Perfect, that's what I love. Second patient, also amazing. The only thing that was wrong is that I can tell in her diet that she is eating, I can tell in the diet that they are eating more carbs and sugar because insulin is increased even though blood sugar is improved. And they admitted, like, yeah, I have a major craving for sweets. But they have been here for a year and have lost 70 pounds on top of like lots of lab improvement, blood pressure improvement. And like, that's just the beauty of weight loss. Like, it's not always just in the pounds too. Like, it is amazing for so many things in their life, but they have lost from 250 pounds to 181. Like, amazing. I also, my grandma works for me, but she's also my patient. She has been maintaining, and so she does well. And then I have 2 more, or I have another follow-up, and then another new patient. Also, I'm in the dark because my son's here and he's on his tablet, and my heater's also going because it's cold. So, day in the life.